Well, let's shift gears to health for a moment. According to the Congressional Black Caucus Foundation, Black women continue to have alarming rates of chronic illnesses. Maternal mortality rates, this just makes me sick, among Black women persist at 3 to 4 times the rate of white women and are 3 times more likely to have fibroids. Well, Dr. Wyland Wilson, a professor of theological ethics at Duke University, is joining us live to tell us about her latest book titled Womanist Bioethics. And she's also going to discuss more about these disparities. Doctor, thank you so much for waking up with us. I mean, this is such an important topic. Tell me a little bit more about your book.
Yes, thank you so much for having me. It is absolutely a pleasure to be here. So my book, Womanist Bioethics, Social Justice, Spirituality, and Black Women's Health, actually shows that the lives of Black women testify to the current state of the healthcare system. And not only testify to it, but they also interpret and critique it. And that's why in my book I use various narratives that center the lives and the experiences of Black women within the healthcare system. And it shows how Black women and other women of color have been underserved and understudied in our healthcare system, and also their experience discounted and even neglected in many ways. So what has been really important is that my book is opening up a conversation about how race, gender, health, and spirituality are important conversations within health disparities. I'm responding to the Black women's health crisis because, as you've noted, some really important statistics, and there are other statistics as well, that half of Black women age 20 and older have hypertension. Heart disease is a leading cause of death for them, and they're more likely than white women to be diagnosed with diabetes. And these disparities are not just attributed to behavior differences or biology, but to the historical and pervasive devaluation of minoritized bodies in this country.
Oh my goodness, I would love just to sit in one of your lectures. You are so intriguing to me. How can we get a copy of this book, and what can we do? What can I do as a white woman to help?
Yes, thank you. And that's really why I did write the book. I talk about the fact that we all have a hand in making sure that we, help to improve the health of one another. And so I talk about that people can engage in awareness, education, advocacy, and collaboration. Those are 4 very important points that any of us can engage in. My book is a first step with offering, some of the issues, what you can do about some of these issues, how you can advocate and collaborate with others, organizations and other individuals who are already doing the good work of addressing these health disparities and inequities. And you can find my book at my website, wylanddwilson.com, and it's also available through Amazon and Barnes and Noble as well.
Well, I really appreciate you, and it's just not right. We're all women, so we need to support each other, and we should all have the same access to health care, especially when I look at the mortality rate with women giving birth. I mean, that's just not right. So I really, really appreciate your time in raising awareness about this.
Thank you so much. I appreciate you having me. It's such a joy.
Thank you, doctor. I look forward to our next conversation.